Good evening, and thank you all for joining us for our Community Leaders Call. My name is Tomas Almonte, Deputy Chief of Staff to Mayor Bowser. In the room, we are joined by our Director of the Department of Health, Laquandra Nesbitt, our Chief of Staff and Acting Deputy Mayor for Planning and Economic Development, John Falchicchio, our Director for Homeland Security and Emergency Management, Christopher Rodriguez, our Director of Nightlife, Sean Townsend. You'll be hearing from multiple speakers this evening on our efforts related to coronavirus. And to get started right away, we'll pass it over to Dr. Nesbitt, who will provide an update from DC Health. So, Dr. Nesbitt.
Good afternoon, everyone. We thank you all for making the time to join us today for an update on the district's activities related to our COVID-19 response to a global pandemic that is having an impact around the globe and here in the District of Columbia. Since our last time together, we have made a number of critical decisions that impact how we are responding to this pandemic, including a number of public health and health recommendations that will allow us to flatten the curve and eventually see a downward trend in the number of cases that we see in the District of Columbia. At this time, we are still awaiting a response to the community mitigation strategies of social distancing that are in place in the District of Columbia. Many of you know that those social distancing strategies include having our children social distance through school closures, creating community social distancing strategies that now have our restaurants where they are all either grab and go or delivery and carry out. And also a number of things that have temporarily suspended many of our community activities that are related to social, cultural, or entertainment activities, and the elimination of mass gatherings that have over 50 people. We have been working collectively with many of our government agencies outside of the health department, including much support from the Homeland Security and Emergency Management Agency that is leading the Emergency Operations Center here at DC Health, and a broad coordination of our efforts to help us respond on a daily basis. Much is being done with our healthcare partners and working collaboratively to have access to testing, where doctors in the District of Columbia decide who receives a test, and ensuring that we are able to identify where the community transmission of COVID-19 is occurring. We, as of today, have 39 cases of COVID-19 in the District of Columbia, and we encourage you to visit coronavirus.dc.gov on a daily basis, where we update the data related to coronavirus on a daily basis. As I mentioned before, we do have evidence of community transmission in the District of Columbia, and at this point we classify our community of transmission as mild to moderate. The reason why we describe it as mild to moderate is because of the impact that is occurring across the region, with over 100 cases occurring between Maryland, the National Capital Region, which includes Maryland and Northern Virginia. We have very porous borders, and so we have to recognize that we can't only classify what's happening in the District of Columbia by the number of cases in D.C., but how the cases in Northern Virginia and the National Capital Region, including Maryland, influence our situation here. So we thank all of you for what you are doing in your respective organizations, and you as community leaders for helping to promote our social distancing strategies. We know it's no small ask of you as individuals and no small ask of you as leaders in the community to help champion these things that change remarkably how we act as human beings and how we lead in our communities. But these are the things that we know are going to have the most significant impact on helping us bend the curve and flatten the curve as it relates to COVID-19 here in the District of Columbia and around the globe. So thank you.
Thank you, Dr. Nesbitt. And again, before we go to our next speaker, I just want to remind everyone of the most up-to-date information and resources are on coronavirus.dc.gov. If you have any questions, we're going to get to a Q&A portion, so you can start getting into our question queue now by pressing 0. So if you have any questions that you would like to ask to our directors in the room, you can press 0 now. We will now hear from our Chief of Staff and Acting Deputy Mayor for Planning and Economic Development, John Falchicchio.
Thanks, Tomas. Just want to remind everybody that the website, as you know, is coronavirus.dc.gov. If you're in front of a computer or laptop right now, if you log on to the site, we'll walk through a couple of the new items. You could also look at it on your mobile device. I'm going to be speaking to you, though, from a laptop computer, and so if you look at coronavirus.dc.gov and you look at the top, there's a navigation ribbon which has several different options. That includes recovery, meal sites, data, and a couple other items too. We wanted to highlight for you today recovery. That's where we've listed out, and so I'll give everybody a moment to get to that. So it's coronavirus.dc.gov/recovery. But that's where we've listed out one of the first resources we have as we plan and implement the recovery. And the first tool we've listed there is the Small Business Administration, the Federal Small Business Administration's loan program. And so the mayor applied over the weekend to the Small Business Administration as a declaration for economic injury. And so they accepted that early this week, and we have posted how small businesses can apply. One note, we've been trying to ascertain how long it will take for applications to be received and processed, and the note we have for everyone is that they are obviously seeing a high volume, and as we get further into this, more states will be getting the declaration, and so there will be more businesses applying. So really, if you know a small business, share this resource with them as a way to ensure that they know about it and that they can start their application process. Our goal is that small businesses apply as soon as possible just to get in the queue for that program. We also know that there are many workers who are facing unemployment, and we want to make sure that they understand how to access unemployment insurance. The best way to do that is to go onto the DOE website, Department of Employment Services website, and there they will have all the information about how to apply. It's important that folks apply for unemployment insurance using a desktop or a laptop. That's the best way to apply. Mobile devices don't quite work with the system. And so that call center has experienced a lot of volume as well because of the great need in the community. And so we really just urge everyone to spread the word that unemployment insurance can be accessed and applied for by going to the DOES website and using a laptop or a desktop in order to apply for that unemployment insurance. And so yesterday the council passed legislation to give DEMPED the authority to provide grants to local small businesses. And so we're in the process of formulating that program. We hope to, by the end of Friday, release the outline of that program, and then early next week to allow DC local businesses opportunity to apply for that program. The reason we mentioned the Small Business Administration program first, their disaster loan program, is because it will be able to go much deeper than the local program. And so it's important that local businesses try to access the funding that the feds have made available for the recovery from coronavirus. And so that's my update for now. We'll keep posting more information on coronavirus.dc.gov in order for you and your neighbors to have all of the latest information.
All right, thank you, Deputy Mayor. Now we're going to go to a few questions. So again, if you have any questions, please make sure that you are visiting, if you have any questions, please press 0 now. But that website again is coronavirus.dc.gov. So we'll go first to Commissioner Branham in 5E08. Commissioner, you are live.
Thank you. I want to express my appreciation for all the efforts that our officials are doing with their outreach to the community to keep leaders informed. And I understand the current priority for the COVID-19 government response, and you're doing a fantastic job. But my question specifically is, would this be a good time to encourage those who are working at home or being at home to take the time to complete the 2020 census?
Yes, definitely. We think, we hope that everyone is following the guidance for limiting to social distancing, staying at home, and a great activity to do that is completing the census, which we hope everyone will do while they're at home. I know a lot of residents have already begun to receive information on for census and how to do that. So we do hope that everyone, as one of your work from home, staying at home activities, that you complete the census. So thank you for reminding everyone on the call about that critical task that is on all of us to make sure that we are getting counted. So next we'll go to Bar Wenner. Bar Wenner, you are live. Bar Wenner, you're live. Okay, we'll go to the next question. We'll go next to Meredith in Ward 7. Meredith, you are live.
Hi, I want to first thank everyone for all that they're doing, and I really appreciate these community updates. It's important for us all to stay on the same page. My question is about food security. I'm hearing a lot of concerns from people about food security, so I'm hoping that there will maybe be a master list, a master resource compiled and put on coronavirus.dc.gov. Talking about food delivery for seniors. I see that there are meal locations listed for seniors, but if there are NGOs who are, certified food handlers that also do meal delivery, or special resources for people with illnesses, or even prescription delivery services. And grocery stores are now altering their hours, prioritizing vulnerable populations for specific hours of the day. So I guess this is feedback and a question of whether or not such a kind of master resource will be compiled and included on the website.
So this is John Felchick. We're in the process of pulling that information together. We will put as many of those resources up on the website as possible, and we're just in the process of talking to a lot of the food providers, whether they are nonprofit provider or supermarkets. So as an example, just today I talked to the president of Giant Food to check in. We've been doing those stakeholder calls throughout the response to make sure that, one, we understand their operating posture, and two, that we're offering any support we can to make sure that food supply stays steady. One thing we do want to emphasize with members of the community is to make sure that we're not hoarding. Hoarding was something that we've seen take impact on the shelves of our grocery stores, and I know individual stores have implemented individual limits. We really have to stress enough that we're doing everything we can to keep the food supply stable, and so what we need your help is spreading the word that no hoarding of food and other supplies.
Thank you, Deputy Mayor. We'll go next to Mike Silverstein. Mike, one second. We're getting you pulled up here to go live. Mike from ANC 2C06, you are live.
Okay, my question, first of all, thank you very much, all of you, for the work that you're doing and the long hours that you're putting in. This question is most likely for Dr. Nesbitt, and that is, what is the status of COVID-19 testing Where are the testing sites that are being done only in hospitals? Who is being tested? How far away are we from having testing available to the general public so that people can know whether they're positive or whether they're not? And is any realistic help from the federal government on the way?
Hi, thank you for the question. So doctors decide who gets tested, and there are a number of options for testing throughout the District of Columbia. So healthcare providers make the decision as to whether or not they are going to offer testing in their practices. We've hosted a number of webinars and sent out a number of different communications to licensed healthcare providers in the District of Columbia, making sure that they understand exactly what it is that they need in their practice to be able to offer testing. We recognized that there was a lot of confusion very early on for healthcare providers where people thought that there were very special things that they needed to have in their practice to be able to test their patients. Essentially, when people are talking about swabs that are needed, it's the same type of swab that is used when you're testing patients for STDs. So primary care practices in the district readily have that supply available because you should, as a primary care practitioner in the District of Columbia, readily be available to test any of your patients for STDs, given the rates that we have here. Now, the next thing that primary care providers should have available to be able to test their patients are what we call personal protective equipment. Now, initially, there was a recommendation that there was a very specialized mask called an N95 respirator that they would need. That recommendation has been changed, and now a surgical mask is appropriate. So personal protective equipment includes face shields, surgical masks, gowns, and gloves. Those, again, are routine items that primary care providers have in their office. Now that this type of clarity is given, we have more primary care providers who are offering the testing in their office and understand what the guidelines are for testing. The hospitals and healthcare providers, in particular in the hospital settings, have the ability to test and have always been providing testing to residents. The challenge that people are expressing in terms of accessing testing is that we always want people to call ahead so a healthcare provider knows that you are coming. Emergency rooms historically do not want patients who are not experiencing an emergency to come into emergency rooms. That does not change in this particular situation because emergency rooms are for people who are experiencing an emergency. Individuals who have signs and symptoms of coronavirus or COVID-19 tend to be experiencing very mild symptoms. And so when we hear people talking about access to testing, it's not an inability of healthcare providers to provide the test, but making sure that people go to the right place for the level of health care that they need. In terms of what we're doing with the federal government, for the announcement that was made last week, we have been in constant communication with the federal government to have a partnership with them for the high-throughput testing that's been described. We have been, through some efforts that Mayor Bowser had in partnership with the governors from Maryland and Virginia, we are very optimistic that we will be getting notification about a partnership with the federal government to establish a high-throughput testing site here in the District of Columbia. When that occurs, however, we will need to be very clear in terms of whether or not this means that everybody who wants a test, regardless of to whether or not they are sick, they have symptoms, will be getting tested, or whether or not we will still be prioritizing testing individuals who are healthcare workers, first responders, and individuals who are older and have symptoms. So I just want to make sure that people know that if they want to be tested, their first step should be to call their doctor because doctors make the decision in the District of Columbia as to who gets tested.
Thank you, Dr. Nesbitt. We'll go next to Rachel Maysworth in Ward 4. Rachel, you are live.
Hi, thanks. I'm on the Age-Friendly DC's Task Force in the Bicycle Advisory Council. I'm not sure which capacity I'm calling in as. Thank you all for all you're doing. If there's anything that we all can do to help, please let us know. But my question is, a lot of the information is being put up on the website, which is great. But what are we doing, the great are we, to reach out to folks who don't have access to the web, especially since the libraries are closed?
Sure, this is John. One of the reasons we convene these community leader calls is in the hope of getting that information out to community leaders who could share it in their networks and in their neighborhoods. The other thing we're doing is we're doing targeted mailings to our seniors to make sure that they have the latest information as well. And then another thing is some agencies have ways of communicating with their constituents or their residents by robocall and other methods as well in order to make sure that they reach their folks. And so we do it through all different methods, and that's why you'll see so much information put on coronavirus.dc.gov in order to make sure that everyone on this call who could hear my voice now is a community leader. And so we ask that you share this information, and it is a good opportunity to check on your neighbors to see how they're doing. We know there's a lot of people who are teleworking now, who are at home, and so this is an opportunity just to reach out to neighbors and give them a call and check on them to make sure that they, one, have what they need, but have all the latest information that we're sharing, especially if you think they're on the other side of the digital divide.
Thank you. We'll go to our next question. Dr. Johnson in Ward 7, you are live.
Hi, thank you again for the opportunity and the news that we are receiving. I would like to know if you could please inform us regarding any grant opportunities that are being offered for nonprofits.
Sure. So we're going to get more information up on the website about the local business relief grant relief program, and we're in the process of developing that to see how nonprofits might be able to participate. The other piece of relief, I know we're working with all of our other sister agencies to see what grant programs they have and how they can push out information about the latest in their grant programs too. So not sure what kind of nonprofit you're referring to, but a lot of our grant-making organizations, grant-making agencies are reaching out to the groups that they work with regularly to figure out what additional grants might be possible and also how to make them as least restrictive as possible, giving folks the flexibility at this time. So really, we want to make sure that if you have a particular nonprofit that is used to working with one of our agencies, now is a good time to reach out to that agency to see if any resources might be available.
All right, and we got time for one more question. We're going to go next to Marissa Miller. Marissa Miller, you are live.
So my question was in regards to business owners. So I'm an LLC, and most of the work that I've been able to do in the Washington area has been as a consultant. And so my question is, the small business loan, does it cover individuals that are LLCs as well?
Sure, it's John again. So if you go onto coronavirus.dc.gov and you check out the loan program that we referred to earlier, is actually a federal loan program that we're advising small businesses to look at and see if they qualify, and then also how to apply. So if you go to coronavirus.dc.gov, it'll list out how to apply, right? And so it'll list what you'll need to apply, and it also will link you to the SBA website, which will show you who qualifies.
All right, thank you. Excuse me. We want to thank you all for joining us on the call this evening. Again, we want to reiterate for the most up-to-date information, resources related to everything you heard tonight, but additional resources, those are all available at coronavirus.dc.gov. We will continue to have these calls in the coming days, so we just want to appreciate you all being on. And, you know, again, as John stated, we do these calls because we hope that as community leaders, you're sharing as much information with your neighbors and your residents, so we hope that you do so in the coming days. Oh, yeah. And then one great thing to remind residents about as well is we are utilizing all platforms to ensure that we're getting out information, resources, but also to encourage social distancing and even provide some great activities. So every morning on DC and Channel 16 at 9 a.m., we have a Fit DC live workout video. That's, again, weekdays every morning at 9 a.m. on Channel 16, as well as the mayor's social media networks. And then at 3 p.m. Every day, weekdays, on Channel 16 and on the mayor's live stream social media networks as well, we have a Fit DC video workout that's for kids. So that is some fun programming that we'll hope you will spread the word. Join us for a great workout. We did some yoga this morning. Got a good little stretch in at 9 a.m. watching that video. So we hope that you'll join us for that content, and we'll be having more content available in the coming days as well. So we appreciate you all joining us on the call this evening. Again, coronavirus.dc.gov, and then Channel 16 for our Fit DC workouts, 9 a.m. and 3 p.m. Thank you all so much for joining us, and we'll talk to you soon.